Good evening, and thank you so much for joining today's webinar, which features Research for Impact, NYU's Marron Institute of Urban Management Responding to COVID-19, hosted by the NYU Alumni Association and NYU's Marron Institute of Urban Management. My name is Michelle Lubicic, and I'm the Assistant Director of Special Events. On behalf of NYU, I want to thank you for joining us today in this special program. Now, before we begin today's session, I just want to let you know all of us at NYU hope that you and your families are safe and well during this time. And we're so thankful you have chosen to keep learning from the collective knowledge of our NYU community. Today's session features our wonderful faculty members from NYU's Marron Institute, who will talk about the amazing work they have been doing in response to the pandemic. Angela Hawken, Professor of Public Policy and Director of the Marron Institute of Urban Management. She is also the director of the Litmus program at NYU's Beta Hub. Constantine Konakasa, Associate Professor of Urban Science and Planning. He's also the director of the Civic Analytics program at NYU Marron Institute. He also directs the Urban Intelligence Lab. Solly Angel, he's the Professor of City Planning and Director of the Urban Expansion program at NYU Marron Institute. If you have any questions during the session, please enter them in the question box, and we'll get to as many questions at the conclusion of the program. Thank you so much again for joining us. And now it's my pleasure to welcome my wonderful colleague, Angela. Angela, take it away.
Thank you, Michelle. We are delighted for the opportunity to spend some time with you and with some NYU alums tonight. If you can progress to the next slide where we can show who's up tonight. And I'll begin by talking a little bit about the Marron Institute for those of you who are not familiar with our work. So the Marron Institute is quite different from a traditional academic department. We're a provostial institute, and we operate as a think-do tank. And our mandate is really quite simple. It's impact. So for those of us who like to do the thinking and the doing, it's really neat to have a job where you're told to just be useful. And that's what attracted me to the Marron Institute, and I think it was similar for my colleagues also. So what we do is we invest in academics who are interested in applied on-the-ground research. We're working with urban managers and practitioners across the country and across the globe. I have to notice that we had someone dialing in from Peru. Hi, Felipe. I have to say you're not one of our countries, one of my team's countries. We look forward to working with you sometime. So we have several programming areas. Tonight, you'll hear from two of my faculty colleagues who are working on issues related to COVID-19. Solly Angel, who directs the Urban Expansion program, and Constantine Kontakasta, who leads the Civic Analytics program. Now, in addition to the two teams you're going to hear from tonight, in addition to my team, we have an air quality program. What they do is they produce large databases on air quality as well as health impacts of poor air quality, and help to ensure that communities that are most impacted by bad air quality receive the resources that they need for mitigation. We also have programming related to transportation infrastructure and infrastructure costs, and ensuring that transportation is affordable for riders. And then very relevant for COVID-19, we have a city finance program. And in post-COVID or during COVID, cities are being hit hard in terms of finances. We're going to see city bankruptcies. So a lot of that work will be really relevant to those cities as they work towards their new normal. Our faculty do teach some classes, but that is not a core part of what we do. Mostly we run research projects and we raise external funding to support that programming. So we offer really good applied research experiences for NYU students. At any point in time, we usually have about a dozen students working with us. They work with us as colleagues on our projects. They interact with our government clients, and they come from all parts of NYU: data sciences, statistics, public policy, business school, engineering, arts, you name it. So it's a nice diverse mix of thinkers, which we always think makes for a richer project, and we're grateful to have them. So thank you for letting me spend a few minutes telling you a bit about the Marron Institute. Now we're going to introduce the work that we're doing that is specifically related to COVID-19. And I'll begin with my program, which is that I also direct, in addition to serving as the director of Marron, the Litmus program. And at the Litmus program, we focus on innovation and decision-making in the government sector. And we work on a wide range of issues, from criminal justice to education, to social services, to public health, working alongside practitioners as we help them improve their processes. And across our portfolio, we're working in about 30 states and 6 countries. Since COVID, my team has been really busier than ever, and we were lucky to be able to reorient a big share of our research portfolio to issues related to COVID-19. And yes, we did have active projects that had to come to a screeching halt, which is never fun. Any research we had underway in prisons that involved contact with people or going into prisons was suspended. Our in-school projects were stopped. We also have many international sites, and those projects also came to a screeching halt. But we quickly rolled up our sleeves and got busy doing, and the government agencies that we were partnering with were absolutely reeling. There is no such thing as business as usual during COVID-19. It's absolutely business unusual. And we wanted to very quickly share information about sort of the promising approaches that were bubbling up across the country in responding to COVID-19, and also make sure that we kind of were catching the learning. There were a lot of good ideas that were bubbling up in the mix. There were many things that kind of this crisis created a willingness to try things that agencies might not have been willing to do before coronavirus. So we wanted to make sure that we really grabbed those opportunities to learn when those changes were taking place. Michelle, if you move to the next slide. In our corrections portfolio, we hosted learning sessions really with practitioners from across the country. We had over 100 practitioners, over 20 states included, and we issued a report on very practical ways to assist the states that were looking to have early release of people from prisons. People in custody are at higher risk of infection. It's because of their kind of close living quarters. Many of our prisons are overcrowded. That means that they have more people living in them than those facilities were designed to accommodate. So in that sort of environment, infections spread really quickly. And if you look at concentrations of infection across the country, highest concentrations have been in prisons. And the problem is that those infections can be quite consequential, because a lot of prisoners tend to have co-occurring disorders. And that makes for a toxic mix. So many states are allowing prisoners to release early, just short of their normal release date. And these are consequential decisions. It's this is a stressful time for people in custody. It's a stressful time for their families. So the decisions about who's going to be released, is that process fair? Is it transparent? And it also has to be really quick. Otherwise, there's no point. So we've been advising states on how to move those people out in a way that is fair, and also making sure that the resources are in place to assist with those transitions as they move into the community in a safe way. We also have a report coming out in a few days on what COVID-19 has meant for community-based organizations. They've been hit really, really hard. Many of them are down staff. Many of them are shuttering their services entirely. So we have a lot of people out there that are very vulnerable right now. And we've provided some recommendations for states for what they can do to help these community-based organizations now. Michelle, if you move to the next slide. As part of our work, we've been generating early warning systems for this first round is for prisons, and it will ultimately include jails. Early warning systems that really predict where we can expect some outbreaks in correction settings. This sort of early warnings give, so the orange dots on this map are prisons. These are just state facilities. It's other maps for different sorts of facilities. And then also we overlay these on measures of that are kind of community-based measures of concern, that where we can predict that a prison might be facing an outbreak. And why that's useful information is it allows those kind of the leadership to make sure that PPE is directed to the facilities that are most likely to face the most problems, and that they allocate healthcare staff accordingly, and also can prioritize those sorts of facilities to early release. Next slide, Michelle, please. Right, we also have a sizable research portfolio, and our in-school research stopped because schools shut down. But we partnered with a Brooklyn-based nonprofit called ReadWorks, and they are the largest online provider of reading and comprehension resources in the United States, actually one of the biggest global players too. And they have a user base of about 1.7 million teachers in the United States, and they're accompanying, it was about 20 million students. So we're able to study their massive repository of data and observe changes in educational practices real time. So we have reports coming out soon on the education effects of COVID, and we're tracking online utilization. We're very concerned about, educational deserts that are emerging. It's one thing for teachers to provide resources online to children. It doesn't mean that the kids can actually access them. So we'll be tracking the sort of digital divide and seeing what's happening in terms of exacerbating education gaps that existed before, but are really being magnified now. And that so many social issues are interrelated. There's a strong link between early education and subsequent justice involvement. So these are all issues, whether it's on healthcare or education or criminal justice, that we're concerned about. And the graphic you see on your screen now, this is just tracking, this is New York State only, we have the national data too, but looking at New York State, we're tracking as teachers were creating new accounts in the system. And what you can see, and again, there's 1.7 million teachers in the system, but what you can see, the first dotted line there is the date of the first closure in New York State. So the time when the New Rochelle was shutting down their first schools. And you can start to see an uptick, right? The teachers are starting to, new teachers are starting to create online accounts as they're transitioning to, the new reality of online education. And then, the second dotted line is the date when we had the announcement by Governor Cuomo of the statewide shutdown of schools, and you see this huge spike. And the red line is actually low-income schools we would consider low-income schools. More than 75% of the children there are receiving free or reduced, subsidized lunches. So we see this big move online for the low-income teachers. Now, what happens to these students? So we have reports that really document these changes. It's one thing to have a teacher trying to get you online. It's another thing where there are students actually to get online and access those resources. So lots coming down the line on criminal justice, lots coming out on education, and then also in our healthcare work. But that's enough from me because we all have limited time. I'm going to hand over to my colleague, Solly Angel, who's been doing some wonderful work on mapping, and I'll let him take it from there. Thank you, Solly.
I'm going to speak about the coronavirus and American cities. Cities, and more precisely metropolitan areas, what we call MSAs, are integrated and relatively self-contained urban economies with a high level of face-to-face connectivity within them, a connectivity that spurs their productivity and creativity. The spread of the virus, because it mirrors this face-to-face connectivity, is metropolitan in scale. It doesn't stay within well-defined live-work communities, but following commuting patterns, spreads across entire metropolitan areas, which are geographical areas that are largely self-contained. Look at this first slide. Chicago on the left, Atlanta in the center, and Boston on the right. They're metropolitan areas showing a small random sample of commuting patterns. Workers in these metropolitan areas have access to all jobs, and firms have access to all workers. This is what makes these places so productive. To wit, the 10 US metropolitan areas with the largest numbers of reported COVID cases: New York, Los Angeles, Chicago, Boston, Washington, Philadelphia, Atlanta, Miami, Detroit, and New Orleans, account for no less than 29% of the US gross domestic product. Metropolitan areas are also single markets for specialized goods and services, for entertainment, for sporting events, for tourist attractions, and for education, especially for higher education and research institutions. There also are global transportation hubs. In short, the metropolitan areas of today are the places where connections are both intense and widespread. This is why the so-called epicenters of the COVID-19 epidemic, both in the United States and in the rest of the world, are cities. We therefore need to focus research on COVID-19 on cities and metropolitan areas. The United States collects data only for states and counties, but fortunately we can use county data to focus on cities by looking at MSAs, metropolitan statistical areas that are made up of counties. This has been our main thrust, trying to shift the discussion from states to metropolitan areas. This is an uphill struggle because our present governmental structure does not allow for it. We have state governors and we have local authority mayors, but the virus is largely metropolitan in scale. And just as we have failed to generate a coordinated national response, we've also failed to generate an appropriate metropolitan response. Not only are US metropolitan areas agglomerations of many local authorities, 10% of them cross state boundaries as well. The Chicago metropolitan area, for example, spans 3 states and contains no less than 1,550 local authorities, each with their own mayor, health department, and police force. Its governance fragmented, too fragmented for a coordinated response to COVID-19. One important lesson from this pandemic is that we have neglected to take metropolitan coordination seriously for way too long. We now have to empower metropolitan coordination, not only for transport, pollution, and waste management, but for public health as well. Not surprisingly, our great cities and metropolitan areas have received all the blame for the current pandemic. Cities are blamed for much of what is wrong with our world. This anti-urban outlook, with us since the time of Jefferson, Marx, and Mao, is alive and kicking. And in the United States, it has recently been politicized as well, as our big cities, more educated, more diverse, more globalized, and hence more liberal, remain the anathema of reactionaries that still dream of that long gone America of insulated white villages and towns. Cities celebrate proximity, and their great proximity results in higher density, much higher than that of villages and towns. Long celebrated for their proximity and density, they're now blamed for their proximity and density, their reasons for being, so to speak. Indeed, we can define the great wave of urbanization that started in earnest at the beginning of the 19th century as the gradual movement of more and more of us from being closer to the land to being closer to each other. The social distancing agenda that now keeps us apart from each other has been very successful in slowing down the spread of the virus. In fact, by 14 May 2020, 59% of US metropolitan areas, accommodating 63% of the population, are now already 14 days or more beyond their peak of reported new infections. Second slide. What you can see in this slide is how far each metropolitan area is since peak number of cases that it has experienced. And you see that most of them are already past peak, and many of them are more than a month past peak, but the majority are already more than 2 weeks past peak. That means that cities are actually managing to confront and take hold of their destinies. This has led some of us to view social distancing as the new normal, questioning the viability of cities in general and their high densities in particular. High density, people claim, has now proven to be unsustainable. And if so, we must now plan our cities and maybe our country as well with lower densities in mind. This is a sad misunderstanding of the prime objective of social distancing, flattening the curve, namely slowing down the rate of infection so as not to overwhelm our healthcare system. We now know that the virus will be with us until we're vaccinated or until we attain herd immunity. It's not going away. Yes, we need to protect vulnerable people. Yes, we need to isolate the sick. Yes, we need to learn how to weather this storm without losing our heads. And yes, this too will pass. The ingenuity, the productivity, and the self-organization of our cities have rendered them resilient. Cities New York chief among them, are the epicenters of the creative spirit that keep them alive and thriving. Great American cities are now showing the way. They've been pronounced dead before at regular intervals, it seems, and like the legendary phoenix, they've come to life again. I strongly believe that social distancing teaches us nothing about the long-term viability of cities, or for that matter, of high urban densities. High urban densities remain viable and will remain so for generations to come. We can now already see the largest and most productive MSAs, the metropolitan statistical areas that have instituted effective social distancing, retreating from the pandemic. Next slide. By 14 May 2020, for example, there were only 50 MSAs, 13% of the total, where the 7-day running average of new coronavirus deaths was doubling in less than 5 days. These are what we call hotspots. There are very, very few of them. They contained only 5% of the total MSA population and reported a total of 23 new deaths, 1.7% of the total. All the big cities are retreating, they are beyond peak, and they are very unlikely to double their cases in less than 5 days, and they all did so before at the beginning of the pandemic. In our view, the cities and more generally the metropolitan areas that now house 85% of the US population are the true battlefields against the COVID-19 pandemic. And they're far from being able to organize effectively against it while coming back to life. We need to understand and monitor our metropolitan statistical areas in the months to come and come to see how they fared, and more importantly, why some fare better than others. We have set up the statistical machinery for studying and monitoring COVID-19 at the metropolitan scale in US cities for this purpose. We focus on their curve, how many cases they had, how high and when were their peaks, and how rapidly their declines from peak. Our models show the effects of urban density, use of public transit, the effect of social distancing policy, the share of minority communities, the share of vulnerable people, the share of older people, the international connectivity, and the effectiveness of public health systems on the curve. They all matter. And our statistical models attest to that. We believe that the quicker we can turn our attention from numbers for our country as a whole, or for numbers for states, and focus on our cities, the faster we can come to grips on how to bring our economy back. Our economy is by and large a highly integrated urban service economy. Its productivity and resilience rely on its connectivity and its linkages at the metropolitan scale. It is those linkages that need to be brought back in a sensible manner in the months to come. Thank you.
Thank you, Solly. I know we saw so many people exit the city in the wake of COVID. And we're so grateful for the work that you're doing that's really highlighting the importance and the resiliency of our city. So thank you for that work. Next, we're going to turn to my other faculty colleague, and that's Constantine Contacosta, who's going to give us an update on his work with the Civic Analytics team. Thank you, Constantine.
Great, thank you, Angela. Appreciate it. And thank you all for joining. I'm going to spend my time talking a bit about our work as it relates to COVID-19 through a new National Science Foundation RAPID grant. The National Science Foundation, among many of the federal agencies, put out a number of research opportunities for timely research on the pandemic. And so we were fortunate to be one of several at NYU that have received such a grant. So if you go to the next slide, please. Our work in this is really focused on how we could use large-scale mobility data to better understand both the outbreak itself and the response to the outbreaks. So from this perspective, we're using an incredibly large geolocation data set derived from smartphones that covers about 60 million users across the United States over a 2-year period. And trying to better understand a couple different things. One is obviously, and Solly mentioned several times, we're understanding the significance of social distancing measures, both from their long-term implications, but also kind of the immediate term of how do we manage this crisis in a way that balances the very real health threats from COVID-19 with the very real mental health, physical health, and economic health threats from kind of holding up and quarantining for extended periods. So what we're able to do using these data is to measure at various geographies and timescales, everything from the neighborhood all the way up to the country as a whole, to measure at a very high resolution how well social distancing is working. And then be able to do comparative studies to look at how different cities' approaches and how different policy approaches have impacted the number of infections and hospitalizations and ultimately deaths. So we hope with this type of information, there's a million things we can do with it, but one of them is really going to be to understand what works and how. Where do people respond to social distancing orders, and how do they affect people differently in different parts of a city, in different regions of the country, in different cities across the country. So that's one important piece of this. Another piece of it is from these data, we can extract large-scale mobility patterns. And from that, we can do a much better job, at least in my opinion, of being able to predict where future outbreaks will occur and to what extent and the magnitude of those outbreaks. I mean, if you've been like me recently, of course, you've been grappling with all these models of where we are in the peak and where we are in the curve and all these understandings. But these models are largely derived from kind of homogeneous assumptions about how people will respond to social distancing orders, the transmission rates of the disease, and of course, just looking at overall exposure rates in different areas. So there's very little beyond maybe state or county level kind of modeling. There's very little heterogeneity in this, and what I mean by that is, different people in different parts of a city will have very different mobility patterns as in their normal course of daily life. They will then therefore have different exposure risks. How far people travel in different regions will ultimately impact, where the disease might spread based on where outbreaks occur. So we're trying to understand all of that. And then as a bigger picture piece of this, obviously, there's been a growing interest in using these types of large-scale mobility data for this and other types of kind of like modeling purposes. But there is increasingly a very significant and justified privacy concern about who is controlling these data, who accesses them, how are they used, how are they stored. And so what we want to better understand is kind of really what are the kind of privacy concerns here, and how do we actually use these data in a way that minimizes the privacy concerns while maximizing the public health benefit. And from that, we think we could really make a contribution to say that, if we're looking at this from kind of the potential benefits to society, there's a certain level of data collection that may be valuable, but maybe we don't need to be tracking everyone every minute at every exact location that they are. And maybe that kind of data collection shouldn't simply be allowed. So we want to understand what the trade-offs are in that case. So if you go to the next slide, I'll give you some examples of where we are. We just received this grant. So this is, some of this will be from other work related to this and using the data and using similar methodologies. And this is an example of what we can do with these data. This is work we're doing to better understand the response to Hurricane Harvey that struck Houston, Texas a few years ago. And one of the things we wanted to understand is, how do people respond to evacuation orders? Who gets affected and how quickly do neighborhoods recover in terms of their ability to get back to normal? And then how do different communities respond in terms of their, what kind of locational decisions do they make? So this is just an example using actual data from the time period of people who relocated within the Houston area. So these are people who might have been staying with friends or family or going to evacuation shelters or homeless shelters or other kind of facilities. In the middle, you could see kind of a group of people who went out and spread out to other parts of Texas, and then people who went to other parts of the country. And why this is particularly relevant to the current situation is we've read recent research by my colleague on this grant, Arpit Gupta at Stern, and we also are benefited by being joined by Lorna Thorpe at the School of Medicine in the Department of Public Population Health, excuse me. What we've seen, of course, is this emptying out and hollowing out of cities, particularly by wealthier individuals. And using these data, we could understand what these patterns look like across the entire country. And then ultimately, kind of how does the return and the migration, the remigration, if it does exist, begin to occur? So this is really important in understanding, again, exposure. So if we're looking at, for instance, New York City and zip code level infection data in New York City, we might look at per capita measures that are based on census population estimates. But of course, these population estimates are based on a very static figure of where people live. It's not where they actually are at a given time. So, per capita estimates in Manhattan, we know are going to be skewed because large swaths of the population have left Manhattan, whereas exposure risk might be much higher in a place like the Bronx, or parts of Brooklyn where people haven't had the option to leave the city. So we really want to understand what all this means, and then we can use this to better understand the very significant socioeconomic disparities in who is affected by this disease. Next slide, please. Another thing we want to be able to do is really understand kind of what is normal activity in a city or in a neighborhood, in a community, and how does this type of shock impact that. And again, this comes to understanding social distancing, so we can understand activity in area and how it changes based on different shelter-in-place orders. We can understand this in terms of economic activity in a region and how quickly different economic, how different local regions might respond economically as we come out of these shelter-in-place orders and social distancing orders. So this is data that we're using from Seoul, South Korea, which publishes an unbelievable amount of information about population activity at a very localized scale. And this just kind of shows you kind of across three different populations: Korean citizens, foreigners who are kind of extended stay or longer term stayers in the country, and then short-term visitors to the country, what the impact of the kind of main part of the COVID-19 outbreak has been. And you could see slight changes in kind of Korean citizen population activity across the city, and more dramatic changes in kind of the short-term visitor activity. And quite dramatically, you can see that. So if you go to the next slide, I mean, this is very useful for looking at changes over time, but we also want to understand changes over space. And Seoul actually publishes these data, the city of Seoul publishes these data for hundreds of districts across the city, a kind of hourly population count that's derived from cell phones and other data sources. And so this just shows on the top of the slide, 3 different Monday mornings, one from January, one from March, and one from April. And the bottom slide is 3 different Saturday evenings, one again, January, March, and May. And you could see kind of the 3 hotspots on the top left slide of where the central business districts are, and then the kind of population intensity in the morning on Monday morning. And then of course, how that has faded through March and then started slowly to recover at the end of April. Conversely, on the Saturday, on the bottom of the slides, you're looking at kind of where residential activity is, and also kind of where entertainment and nightlife activity is. And we could see these hotspots across the city. And then of course, them kind of fading out through March and then slowly starting to return in terms of, where we are in May. So again, this gives us an opportunity to really understand, how this is changing behavior across the city, and how these types of different kind of social distancing orders are impacting different parts of the city, and ultimately who is most dramatically impacted from all of this. And then if we go to the next slide, this is, another component that we're working on. Another NSF-funded project we have is to understand bias in self-reported data. In particular, we're interested in 311 complaint data, which is these are city systems that cities have set up to allow residents to kind of complain or report about different conditions across the city. So one of the things we're really interested in understanding is how the nature of these complaints change across different cities. And we've extracted these data now for about 40 cities across the US. And so we could kind of see in this New York City example from beginning of February to the beginning of May, kind of a very significant increase in the number of residential noise complaints, number of price gouging complaints, especially in early March. And then, of course, we see this purple area of social distancing complaints. And why we're most concerned and interested in that is what we're going to be able to do is look at the complaints. Where do people complain about people not following social distancing orders? And then look at the actual data about activity in those areas to understand how kind of reporting and kind of perceived measures of social distancing impact what's actually happening on the ground. So again, we're very concerned with what this means in terms of comparing, how people might feel about what others are doing versus what they're actually doing in a given area. And this will ultimately better inform policy and kind of other behavioral interventions to improve kind of social distancing orders and kind of response to those orders. So I think that's my last slide, and then ultimately that's really what we're focused on doing, is helping epidemiologists really develop better and more refined models using these data to improve prediction and understanding of the kind of future disease spread. So thank you very much.
Thank you, Constantine, and just again, congratulations to Constantine on receiving that NSF Rapid Award. Those awards from the National Science Foundation are prestigious, and really they kind of demonstrate the sorts of investigators who are able to nimbly redirect their portfolios to focus on issues that really matter now. For the violets out there, just so you know, of all, NYU was the top ranking university in terms of receiving awards, which just shows how in general the university responded so nimbly to making sure we oriented the best research towards this crisis. I want to just now, for those of you who are on, at the bottom of your screen, you'll see a tab, a Q&A tab, where you're able to pose questions directly. And I'm going to just moderate the Q&A with the presenters on tonight. The first question is going to go to Solly. Solly, both you and actually Constantine pointed to kind of changes in the New York population following COVID, and Constantine actually pointed to how in Manhattan, we saw a large density reduction in Manhattan. We didn't see these sorts of density reductions or outflows in poorer neighborhoods from Brooklyn and then in the Bronx. So looking kind of over the longer term, what do you think the longer term effects of this pandemic are going to be on population patterns in the city, especially with respect to income distribution?
Well, I don't think it's going to have, the income distribution problem in the city has been worse before this virus. And particularly in Manhattan, all the area below 19th Street has become largely unaffordable to lower income people. And they've been out migrating from Manhattan for a long time. The thing that I see happening in New York that is the most worrisome is the future of the subway and mass transportation more generally. The subway, of course, has been losing a lot of money. It is the most dangerous place to be, and the idea of kind of standing very close to a lot of strangers is totally anathema to what New Yorkers are willing to do. So bringing the subway back, and the subway, as you know, carries millions of people to work and to all these other markets every day. And how are we going to keep this subway, and how are we going to improve it, and how are we going to continue to subsidize it, is something that is extremely worrisome. So I think that the connectivity, you talk about Manhattan, people have to come to Manhattan for Manhattan to work. And if they can't come by train, there's no way that people can come by car to Manhattan. It's has very little street capacity for cars. So what will happen to the public transportation system here is actually the most worrisome part of the equation.
Thank you. And In your presentation, you briefly mentioned privacy concerns. Are there any other reasons why using kind of mobile phone data, the sorts you described, is not yet standard practice in addressing epidemics?
Well, I think it's a few different things. I mean, one, of course, that these data are relatively new. While smartphones have been around for close to a decade or more at this point, the collection, the widespread adoption and use of these types of devices is really something only over the past several years. And so the collection of this type of information is relatively novel. Another big challenge has been just the computational power needed to actually process these data. In our data set, for instance, we're looking at close to 500 billion individual data points. And so this is, these are things that require high performance computing capacity, which NYU has in abundance now. It requires new ways of kind of modeling and computing. So that's a piece of it. I think another component, that may be a barrier to this and is becoming less so, I think, given the critical need right at this point to better understand what's happening, have been kind of the concerns around, who's controlling these data and how are they being used. Unfortunately, right now, obviously, most of these data are being controlled by private companies who use them for all kinds of purposes that are not explicit to the people who are providing the data or who they're collecting data on, which raises really significant concerns. I, for one, perhaps having been too close to these data, keep my location off on my phone and make sure my apps are not doing that as well, because, there's concerns that private companies have this much information about folks. So, I think there's a really pressing need for the public sector, government in particular, to come in, begin to regulate how these data are being used, regulate how they're being stored, regulate who has access to them. And of course, what's being collected. And we're seeing more aggressive policies along these lines happen in Europe. We're starting to see those conversations happen much more earnestly here in the United States. And so, what we're hoping is that we can contribute to that conversation to say, that either we don't really need that kind of high resolution data for these purposes, that doesn't really add any value, or conversely, that yes, having this high resolution data really actually helps considerably in the kind of public health realm. And maybe we need to start regulating it as kind of public health related or health related data. So I think there's a lot of different directions in where all of this can go. But thankfully, we're seeing a much more robust conversation about these types of issues.
So one quick question came in, maybe we can have a few seconds take it, is how much more collaboration do you envision between the public and private sectors after this crisis? Do either one of you want to take a quick stab at that? We only have a minute to go. Do you think there'd be more public-private collaboration as a result of this?
If I may say something about that, I think that this crisis has exposed the deterioration of our public sector over the years. We have weakened it too much. We have privatized too much. We have compromised our public institutions in a way to make them too weak to be able to handle such big crises, and there will be more crises to come. So I think that this has given us an important topic to think about, how we have to rebuild our public institutions, how we have to strengthen our public institutions and our public works and our public discourse. I think that when we talk about infrastructure, it's the same. When we talk about public health, it's the same. We need a new era of publicness and public works and public concerns that we have lost over the years.
Great. Thank you, Sally. We really are out of time. I want to make one more plug for NYU in the spirit of collaboration. Over the last few months, there's been extraordinary collaboration among faculty across this university. We are routinely on Zoom calls like this, sharing data, sharing ideas, sharing teams, sharing homes for labs. Quick labs have popped up in little homes all over the state. So it's been a real spirit of collaboration and just been extraordinary to be part of it. As we mentioned at the beginning, our work is externally funded. We'd be grateful that some of the funders have stepped up and quickly allowed us to nimbly change our work and to really be directed towards this. But here are some resources where you can, please sign up for our newsletter so you can stay up to date with what we're doing. You can follow us on Twitter. My email address is there, ahawken@nyu.edu, if you'd like to find a way to stay engaged, volunteer, donate, whatever it is. There's lots going on. There's so many worthwhile enterprises at NYU. So please stay informed about all the work, it's amazing work that's happening at NYU. It's really been a time, I think we've been so inspired to be part of this amazing institution. Top quality work happening everywhere. Thank you all for joining us. I know that there's dinner underway and kids underfoot and other things to compete with this. We really appreciate taking this time out of your lives to be with us. Thank you so much. And thank you, Michelle, for coordinating. Bye-bye.
Great. Bye, everyone. Thank you.
Thank you. Thank you, thank you, Angela.
Thank you,
Thank
Sally.
you for inviting me. Thank you, Michelle. Good to meet you.
Very nice meeting you too. Thank you, Angela.
Bye-bye.